Welcome to today's update. It's Saturday the 6th of June. Now I've got some interesting news from the United States today, and then I want to look at some principles issued by the Centre for Disease Control. Then we'll look at some news from Peru and the United Kingdom, and we'll finish off with a comment or two about Canada as well. And there's some interesting principles coming out of the material that I want to do today that apply to everywhere, so I think well worth watching wherever you are. Now, let's begin with this. COVID-19 update, United States. Now, this is a new site I've just come across. And what this does is it gives the R value in real time. So the R value, as you know, is the amount of people on average that an individual infected person will subsequently infect. And RT is an estimate of that value in real time. So the actual now, what is it now? It's snapshot data. So what's the RT today, the time now? And of course, if it's greater than 1, the cases will be increasing. If it's less than 1, the cases will be decreasing. And in all of these states, the R value is currently greater than 1. So in all of these states, we can expect increased number of cases. And in the next few weeks, increased numbers of deaths. Tennessee, Idaho, Kentucky, Arizona, Washington State, Florida, South Carolina, Utah, Georgia, and Vermont. And that is in order. So in other words, Vermont has got the highest R value. The other states have actually got RT values, real-time R values of slightly less than 1. So these states are currently the ones where it's increasing. So we're like Vermont, for example, a rural state up in the northeast, and yet cases are increasing higher than any other state in the US. So unfortunately, that inevitably means there's going to be more cases and more deaths as a result of this increase in the R value. Now, the Centre for Disease Control, look at the reference there. This was interesting. Knowledge and practices regarding safe household cleaning and disinfectant for COVID-19 prevention, United States, published on the 5th of June, research carried out over the month of May. And I was actually quite taken aback by this, the abuse or inaccurate or improper use of household domestic cleaning disinfectants and bleaches. Now, there's been a sharp increase to calls to the poison centres in the States. Now, what we do if a person comes in with poisoning, because we don't see it very often in emergency departments, we normally ring up the local poison centre or the regional poison centre and say, well, this chap's taken such and such, what do we do? And they'll say, right, give him this, that or the other and do something. And they'll tell you what to do. So these are the poison centres where this specialist knowledge resides and these specialists reside. So there's been an increased number of cases in the United States, 2 poison centres with people coming in who've been poisoned by household cleaning agents. And this is quite alarming and actually quite surprising for a sophisticated country like the United States. So the CDC have done a survey on this and they identified knowledge gaps. Safe precautions for cleaning and disinfecting solutions were not always taken and were not always understood. Use of recommended personal equipment was not well understood. And safe storage was not well understood. And 39% engaged in non-recommended high-risk practices, with the intention of preventing SARS coronavirus 2 transmission, but they were engaging in non-recommended high-risk practices. When you're using these substances, you've got to read what the manufacturer says on the container. Now, I would have thought that a small proportion of people might get this wrong, but 39%, I was actually taken aback. And if that's the figure in the United States, there's no reason to think it's any different in any other advanced country. Now, this is what people were doing. Washing food with bleach. Don't wash food with bleach. Applying household cleaning products or disinfectant products to bare skin. Don't do that. And this is unbelievable. Intentionally inhaling or eating or drinking disinfectants and bleaches. Quite unbelievable. Don't do that. But this is what was happening. This is what this survey by the Centre for Disease Control found in up to 39% of cases that they examined. Quite incredible. So their public messaging should now emphasise evidence-based use, safe practices, good hand hygiene, recommended cleaning and disinfecting of high-touch surfaces. So surfaces that are touched a lot, especially by multiple people, of course, like in a public transport, for example, or a supermarket, should be regularly disinfected. But they want to emphasise the use of high-risk practices, such as washing food products in bleach, applying agents directly to the skin, and actually inhaling or ingesting these substances. So that is quite alarming that people are doing that, and yet that's what this survey says, up to 39% of people are doing it. So whatever you do, read the instructions. And if you've got anyone who you know might be struggling in this area, then just make sure that they're using these substances appropriately. Now, the Centre for Disease Control have published this useful infographic. Always read the instructions. Wear protective gear, hands and eyes, and don't mix chemicals. And if you know anyone who's might be struggling with these household agents, do come alongside them and give them the benefit of your knowledge and experience. Because 39% is a high number. And especially don't mix chemicals. Now, I actually had a case on A&E last year of someone who was mixing chemicals. It wasn't at home, but he was in a work environment. And he mixed a couple of unusual chemicals, and there was a chemical reaction, and it gave off some gas, and it poisoned him. And he was quite poorly, actually. He was in hospital for a few days with that. So don't start playing chemistry sets at home if your knowledge of chemistry is anything like mine, which is very weak. Let's go on now and think about Peru. Now, I've been concerned for some time about people, indigenous groups in the Americas. I have heard anecdotal reports that some indigenous peoples in the United States have been disproportionately severely affected. Haven't got much evidence on that yet, but I'm looking for it. And it does seem to be the same in Peru, where indigenous areas are being more severely infected and indeed affected. So they seem to be getting more infections, and those infections seem to be causing more morbidity and mortality. Now, I haven't got published data on this really, but rural areas, and this is based on a Channel 4 film report on the UK, and they were following a health worker in one of these rural areas in Peru where there's a lot of indigenous people living, so the infection's moving out of the cities into more indigenous areas. And he was saying 80% of people are sick. Now, that is very concerning, because we know that typically in Western countries, maybe 30-40% of people are asymptomatic. They have no symptoms. And yet here they're saying that 80% of the population are actually sick with what is believed to be COVID-19. So it looks like a disproportionately large number of the people that are infected become symptomatic. So that's concerning in its own right. And then he went on to say that 10% of critical cases survive. That means 90% don't. Now, in the UK, 5% of patients were critical. And 10% of 5 is 0.5. So that means that 4.5% of these people, of the 10% that of the 5% that are critical, could potentially die. And given that 80% of people are infected, that could well mean that something like 3.8% of people could potentially die in this population. Now, this is truly alarming. If only 10% of critical patients are surviving, due to more severe disease perhaps, due to other as yet unidentified factors, and certainly due to lack of sophisticated medical care, then many of this 5% of critical groups who would survive in the UK or in another country are dying. 4.5% are dying. Only 0.5% of these are surviving. And that is quite alarming. So I would call on political leaders in these areas where there are indigenous people to really go the extra mile and get the help to these areas that are required. And the other thing that was identified in this report was simply lack of basic community health measures, lack of people understanding what they needed to do. So they need this public health information as well. And I did see the healthcare worker there giving an injected drug for fever, injecting a person with a drug for fever. And he was giving an intramuscular injection. Well, I started as a student nurse when I was 18. In the last 42 years, I've never given an intramuscular injection to reduce fever. There are no such. There are drugs that will do that, but it's just not what we do. It's very, very strange practice. And in these areas, it's probably better to leave someone's fever anyway in adults rather than treat it, because the fever is helping to fight the infection. So given for the best of intentions, but still clearly they need a lot more expertise in these areas than they currently have. So real need for politicians in these areas to step up and really pump supplies into these indigenous areas, because otherwise we're going to get death rates of about 4%, which is clearly unacceptable. Now, the World Health Organization have published some new stuff on masks, which is useful, so I just want to run through that briefly. Don't take my word for it, it's there. Government should encourage people to wear masks in confined or crowded environments. Public transport, supermarkets, all these things. But this has got to be part of a comprehensive strategy. So it's not I'm wearing a mask, I'm okay. It's got to be continued with everything else, with the hand hygiene, with the social distancing. And the WHO continue to advise that people should care for an infected person at home, should wear a mask while they are in the same room as the sick person. So carers at home, looking after sick people, should wear masks to protect themselves from the viruses shed by the sick person, as we've been saying for a good couple of months on this channel, and as indeed has everyone else. So what's new from the World Health Organization? Now, just before I go on, we're talking about the World Health Organization here, and people have rightly criticised it, but it doesn't alter the fact that they have looked at all the latest data on this. They have some of the best doctors and scientists in the world working for them, and they do produce reliable reports. The World Health Organization as a whole has made mistakes, yes, but these reports that they produce are written by people that actually know what they're talking about. So in areas with widespread transmission, medical masks for all people working in clinical areas of a health facility, not only workers dealing with patients with COVID-19. So what this is saying is in hospitals and healthcare facilities, every member of staff should be wearing a mask, not just people that are looking after patients that are known to be positive for COVID-19. So the people in emergency departments should be wearing masks. The people in cardiology departments should be wearing masks. The people in gastroenterology departments should be wearing masks. It should be for everyone. That's their new guidelines. Areas with community transmission, this is outside care facilities now. So if there's community transmission in an area, as of course there is virtually everywhere now, people aged 60 or over, or those with underlying comorbidities, should wear a medical mask in situations where physical distancing is impossible. So again, it's not instead of physical distancing. Physical distancing outside is preferred, but where that's impossible, then people over 60 and with comorbidity should wear a mask to protect themselves. Because the World Health Organization have now looked at this data and have decided that there is a level of protection gained from wearing the correct type of mask. Now, what they're advocating is fabric masks should consist of at least 3 different layers of material. So they're not talking about taking PPE away from healthcare professionals. They're talking about people like you making masks at home. And this is what they say you should use, 3 layers of different material. Now the inner layer is an absorbent material like cotton. That's the inner layer of the mask. Then the middle layer is non-woven material such as polypropylene, which is the filter layer. And the outer layer is non-absorbent material such as polyester or a polyester blend that's going to not absorb moisture from the outside environment. So that absorbs moisture from the mouth, that provides the filter, and that stops the droplets from other people getting into the mask and making the mask wet. Makes perfect sense. Inner absorbent layer, middle filtering layer, and an outer layer that stops other people's droplets containing other people's viruses getting through to your mucous membranes. So they are the type of masks. So all the people at home that are making masks, start following these guidelines and the masks will be much more efficacious than they otherwise would. And this is actually really simple, but when you look at it, it just makes perfect sense. So good to know that the World Health Organization consider that this is consistent with their data. Hand to mask hygiene is also important. So people fiddling with masks and touching their eyes and touching their face. Also to bear in mind. So good mask hygiene. And if you look on the website that I've given you, the World Health Organization give details on washing masks and making masks and all that sort of thing. So basically everyone around the world needs to start bashing out a few masks now, but according to these criteria. Now the trouble is, and the World Health Organization flagged this up, and we have done for some time as well, masks can give a false sense of security. So you don't say, I'm wearing a mask, I'm okay, you're okay. This is as well as hand hygiene, as well as physical distancing. So it's as well as, not instead of. Absolutely vital to bear that in mind. Masks are part of this overall strategy. It's an overall part of a comprehensive strategy. They are not a panacea in their own rights. And the World Health Organization also emphasize the following simple rules. Now, this is nothing new. This has been in public health for decades, but for some reason, medical experts and scientists and governments around the world seem to have forgotten. It's a bit like a bricklayer who forgets how to lay bricks, really. I'm just bemused by what's happened and why the experts have failed to give this advice. Find, isolate, test, and care for every case. Every case. Every. The all-inclusive word, every case. Because I remember our chief medical officer saying we're not going to bother testing these people and there's no point, I think he said there's no point isolating because it's already endemic. You know, this goes against these principles of public health. Why didn't he know that? Trace and quarantine every contact of people that have tested positive. So every contact should be quarantined and tested, kept in quarantine or maintained in quarantine until they're proved negative. And the World Health Organization say that's what we know works. Now, we are starting to do this now. Pity about the last 3 months that we've missed in the UK when that hasn't been done effectively, and in many other countries. Now, moving on to the UK. Now, this is the number of cases on my COVID-19 tracker app today, the King's College London one. This is for all of the UK, so the cases are quite a bit down. Even just in the past few days, the number of new cases is down, which of course is good to see. This is higher than the Office for National Statistics numbers. So the real number of new cases in the UK today is probably between 6,000 and 9,400, that kind of number. But unfortunately, the deaths increased quite a lot up till Friday, actually. Now well over 40,000 deaths. Now, the advice reiterated this weekend by Miss Priti Patel, who is the Home Secretary, said that outdoor meetings are fine of people of different households, but no more than 6 people to meet. That's clear. So you could meet people from another household. 6 of you could meet in a park. You could do a bit of sunbathing, have a bit of a chat, as long as you maintain a minimum of 2 metres, preferably 3, but a minimum of 2. And of course, as long as you're not sharing utensils and there's no handshaking or hugging or anything like that, obviously. So quite reasonable. Meetings of up to 6 are allowed. That's what she says. And she encouraged people not to go to demonstrations with more than 6 people. In fact, it's illegal to have meetings of more than 6 people. This is the law. This is mandated. It's not some sort of option. Then on TV today, I heard Mr. Leroy Rogan, who's a former superintendent, former chair of the Black Police Association, saying people should attend demonstrations. I mean, you have a man of this authority advising people to go against the law and the rules dictated by the Home Secretary. Is just unbelievable. You see, if you don't have government, you have anarchy. And I've worked in places where there are anarchy, and it's terrifying. It tends to be the rule of the strong and the rule of the gun. And it's frightening. I was only there for a short time, but it was a pretty frightening situation. And if we don't have government, we have anarchy. So for senior people like this to say, no, go ahead, attend rallies with more than 6 people. At least we assume he didn't mean demonstrations with 6 people. He said go ahead and attend demonstrations. When the Home Secretary said don't, is just bemusing to me. Because if more than 6 people attend, there's going to be a greater risk of infection. Infection will be transmitted, more people will get sick and more people will die. And the people that die matter. Most of the demonstrators are under the age of 30 in the UK, according to the BBC News report. Now, this, of course, is good because younger people under the age of 30 are much less likely to get severe disease. They're just as likely to catch it, but they're much less likely to get severe disease and they're much less likely to die, so that's good. But, of course, what they'll do, it's not impossible. They could get sick and die. Some do, tragically. But what younger people will do is carry the disease home to more vulnerable people. So by demonstrating, more people are going to get the disease. They're going to carry it on to more vulnerable groups. More of those are going to get the illness and more of those are going to die as if their lives didn't matter, and their lives do matter. The irony here has not escaped me, and I'm sure it hasn't escaped you. And the police have been reluctant to intervene in case they kick off trouble, meaning the police are somewhat intimidated by some of the demonstrations, meaning there's a threat of violence, which is just not acceptable. Now, the R values in Scotland, actually that's wrong, it's about 0.8 in Scotland. 0.9 in England, but parts of the northwest, it's R is 1.01. It's just over 1 at the moment. So this is why Matt Hancock, the Health Secretary, is thinking about having a regional area of lockdown. So what he's saying is, well, if there's a flare-up in one area or one region of the country, then we could increase the lockdown in that measure until the R value goes well down below 1 in that area. But no need to close every area down. And that does make sense because we need to have economic activity. So the idea is that there's going to be regional restrictions which could vary from region to region. A region with more cases could be more locked down. A region with less cases could be less locked down and have less restrictions. So that does make sense. But we do need to do it together. And we do need to obey the rules that the government has put down for our safety and for the protection of others. And if people are advising you not to follow the advice of the Home Secretary, see, I don't care if you like Miss Patel or not. I don't care if you voted for her. I don't care if you didn't vote for her. She just happens to be in charge. And we either have government or we have chaos. And she's giving the advice that will save lives because lives matter. All lives matter. Black lives, white lives, all lives matter. Now, I was going to tell you about Canada, wasn't I? I'm going to show you some pretty incredible people in a minute. But first of all, I saw Justin Trudeau, Prime Minister of Canada, in a crowd, demonstrating in a crowd of people. And I was taken aback. You've got the leader of a country, don't know the guy, don't know much about his politics, don't care really. It's not the point. For a leader of a country to be in a crowd in the middle of a pandemic, to me, is not acceptable. Not acceptable. He was in a crowd of people. And the social distancing on the video I saw didn't look to be too good. In these crowds of people, the virus will spread if it's present. That means people will get sick. That means people will die. So for the leader of a country to go into a crowd to make a political point, to me, not acceptable. Regardless of his, but not a political point, don't know the guy, don't follow him particularly. There's 190 countries in this world. I can't follow them all. Although I have talked to some pretty remarkable people from Canada, of course. But to go into a crowd at this point is disappointing. You see, I have got some advice for Justin Trudeau. If he thinks that Black Lives Matter, which of course they do, and indeed all lives matter, if that's what he thinks, then I would advise him to get his epidemiologists and his doctors testing vitamin D levels all over Canada. Because we know that vitamin D levels are lower in people with darker coloured skin. We know that's certainly true in the United States. And find out how common vitamin D deficiency is. And then do trials to see if supplementing vitamin D enhance immunity, because I believe they will. And that would save a lot of black lives. And a lot of white lives as well. A lot of people's lives could be saved by that. This is the irony here, that the Black Lives Matter demonstrations are going to result in a disproportionately high number of deaths in black people. It's not a race point, not a political point. It's the science as I understand it. Proportionately more darker coloured skin people are dying. And this will spread the infection, and their lives matter. Now, onto a much more cheerful note. If you watched the last video that I put up, it was an interview with Christopher, who is the leader of this pretty remarkable team of people. And these are at the Courthouse retirement home in Cheddar in England. And they've shut themselves in to look after their residents here for the last 54 days. And you can see they're behind closed gates here, and there's a do not enter sign down there. So they've been looking after their residents, living in isolation with their residents for the past 54 days. Absolutely amazing. And here are some of their residents who've kindly let us see their pictures. And amazing to think that some of these lovely people would no longer be with us had this team not taken the measures they had taken. And here they are in the garden. And they've been in these grounds for the last 54 days, eating, working, sleeping on the premises, only talking to outsiders at a long distance or via electronic media. And again, some more of the people that they are caring for, whose lives they have saved. Now, I know what you're thinking. The food looks really good. I tell you what, if I go to a retirement home, I think I'll go to this one because you get wine with your meals. Pretty marvellous. Oh, this is Christopher, who's in charge of it. Now, he's wearing the full PPE here, but they actually didn't need to wear this. This was when they had a bit of a scare about someone who could have potentially been infected. But now the lockdown, they don't need it as much. But he was serving the wine in PPE, so there you go. Always nice to have a wine waiter. Now this is Gary, who is the cook in this place, in a courthouse. Now, Gary has been in this facility non-stop for 54 days. He works 12 hours a day, then has a few hours downtime, 8 hours sleep, and then he's back to work the next day. So he's done 12 hours on, 12 hours off for the last 50 or 60 days without a break. That is amazing. And he's never once asked for an afternoon off. That is the sort of dedication and self-sacrifice. And as well as that, the food is clearly excellent. There was another picture of some chocolate eclairs he'd made, but I can't find that now. But 12 hours on, 12 hours off, given up his own family life, given up his own social life for the last 2 months to care for others. This is the calibre of man that we want, the calibre of men and women in this facility that we want.